say ready when you're ready. Good afternoon, Reposo. My name is Joan Delabrew. I'm the current chairperson for Menominee Tribal Legislature. And today the legislature took extraordinary steps in reference to the coronavirus, or COVID-19, as you've been hearing in the paper. We had the emergency meeting, a declaration of state of emergency was placed in effect, which triggered a number of implementations that will occur that you will hear from Mr. Ben Warrington, who's the incident command, and we also have Vaughn Bowles here, who's an epidemiologist, who's been will be the tribal public information officer. Dr. Slagle was identified as the tribe's public health officer, and she will be probably at a later date in touch with you. One of the things that, from the tribal legislature perspective, is we are really trying to be prepared. We don't want people to be in panic mode. We're hoping we have achieved that success. But this is an ever-evolving, very fast issue. And so our hope is that we can stay up on this all the time with the individuals that will be in incident command and as that team grows. I know that you are going to have a lot of questions and that you have a lot of concerns. We hope that we can address many of them today with some of the things that are in effect and moving forward, as perhaps when they do more activities such as this. I ask that that you work with us and be patient with us as we try to address this issue, and that's because of the vastness of it. And I appreciate all your efforts to be patient and understanding with the legislature and with the team that's in force. So I will be turning it over to Mr. Ben Warrington, the incident command person, and Vaughn Bowles, who is the tribal public information officer. Thank you.
Thank you, Chairman Delabrew. Again, thank you, everybody. My name is Ben Warrington, Emergency Management Coordinator from Menominee Indian Tribe, and the incident commander for this evolving situation here with the COVID-19 virus. I'll introduce my partner here, Vaughn Bowles, epidemiologist from the Menominee Indian Tribe, who is also the public information officer during this incident. As Chairwoman Delabrew indicated, we have set up an incident command here, and that's how we will be dealing with this, and it will be expanding with additional people as we move forward. So today the legislature did post a declaration of a state of emergency for the Menominee Indian Tribe. With that state of emergency, there are a number of things that we have implemented today by this declaration. And we're going to go through these one by one, just a little synopsis of each one of them. But the first one was, we talked a little bit about it, but we did set up incident command for this. The incident command center is going to be occupied, and we will be developing that full IC structure here. We will have additional meetings with some of our other governments here, school districts, county government, as well as casino and others as well. We will have daily incident command briefings and additional information that's going to go out to the tribal public as well. The second one is we're going to be doing some travel restrictions. All off-reservation travel is canceled and prohibited for the next 45 days. This is for tribal employees. So any tribal employee is prohibited from traveling off the reservation for 45 days. That's not to say in 45 days it's done. We will be looking at that as we move forward, and we will, if we need to, we will implement additional 45-day periods. We do have a process for exemptions for this travel ban, but those will be taken on a case-by-case basis per departments. The third one is we are prohibiting on reporting to work for employees who reside in a county with a confirmed case. So if we have a tribal employee that lives in a county that has a confirmed case, that employee is going to be told that they need to work from home, and we will work through issues in order to help that employee do that. And that's gonna be for a period of 14 days. I think, Vaughn, you wanna talk a little bit about the 14-day period and why we came up with that?
So according to the Center for Disease Control, or the CDC, when a person is exposed to the coronavirus, it usually takes between 2 and 14 days to start exhibiting symptoms. And so that's part of the reason we've implemented a 14-day period as isolation or quarantining when people return, is because if they have been exposed, they should start exhibiting symptoms within that time frame.
Great, thank you. The fourth one, our transportation services, all non-medical related transportation services to hotspot counties are canceled for the next 45 days. Now, hotspot counties are where there are active confirmed cases. Currently, those hotspots, I think they were Fond du Lac, Waukesha, Dane, and Pierce counties. We actually have 4 of them within the state. So again, those will be for 45 days, and that's another rolling period. So if we need to look at that coming up on that 45-day period, we may institute another one beyond that first 45. So number 5, we're looking for a self-quarantine for those on travel. We have some tribal employees that are on travel now, and those tribal employees will be self-quarantined for that 14-day period. We will work with them to give them the ability to work from home, so that will not hinder them from doing their work. The 6th one, we're asking people to stay home if your child or yourself is sick. Employees are out sick and have sick children, just stay away from work, take that time, and take care of yourself. Number 7, tribally sponsored public events hosted by tribal departments. All of those events hereby are canceled. That includes any type of powwows, sturgeon feast celebrations, any type of public events where those people are gathering, and that's a 45 days from now. And again, we would be looking at additional 45-day periods as we move forward. Number 8, our Tribal Fitness Recreation Center. Currently, our fitness center, activity rooms, and workout areas are closed for the next 45 days. We will look at it again. This is another 45-day rolling period. So right now, it is closed for 45 days, and we will look at it when we get to that mark. Our elder meal site, number 9. Both of our elder meal sites are going to be for takeout only. Our food service will still be provided, but we're going to be converting that to a takeout only. We will be working with the elders, letting them know how this is going to transpire, and we'll make sure that our elders are able to receive their daily meals that they would get at those sites, or the home delivered. Those will not stop. Number 10, the food services. Other food service providers such as Boys and Girls Club, the Recreation Center, etc., they should discuss the closure or other food delivery options with our public health officer. Those departments and those agencies, we're asking them to work closely with our public health and make the needed changes to that. The number 11, we're looking at our detention, our CBRF, our Manasaikia residential, Eagles Nest, and DV shelters. Those are all closed to visitors. Those facilities that house any type of individuals, they're not going to be taking any visitors whatsoever. That does include family, legal reps, and guardians. 12th step we're taking is additional housekeeping staff. We have done some emergency hires in our housekeeping staff to add people to just come in and assist us with disinfecting and cleaning tribal facilities. We may look at, in the future, look at shift differentials and changing shifts for some of the people and the employees here in the departments. 13, we're looking at all of our governmental meetings are limited to 20 or less people at those meetings. The meetings of government elected officials, committees, and staff, 20 people or less. Non-essential meetings, we're looking at canceling those, postponing, and we are also looking at some other options in regards to the important business that needs to be done at those meetings. So, again, those are canceled. 14 is departmental meetings. All departmental meetings or individuals from outside of the reservation boundaries, those should be conducted via conference calls, Skype video conferencing, or other measures. Our IT department will work closely with any department within the tribe that needs to have these type of meetings, and they are ready to do that. 15, identification of essential services. The administrative committee will coordinate the identification of essential services in the event, only in the event, if the workforce is reduced due to illness or quarantines are required. Number 16, meals for our children. Tribally operated schools, Head Starts, daycare centers will be developing plans on how takeout meals, bagged lunches, and etc. can be provided to our school-aged children. In the event, that's only in the event of school closures. We're looking at some additional special considerations regards to our aging personal care workers wearing protective clothing, as well as finding substitutes for those people if they are feeling ill. And again, as far as the incident command structure, myself have been put as the incident commander. We are working closely with our clinic staff, and our Dr. Amy Slagle has been appointed the tribe's public health officer. She will be guiding us as we work through this thing. Vaughn here has been appointed as the tribe's public information officer. Will be coordinate all of the public information and news briefs and everything will be coming through Vaughn up through the incident command. Menominee Nation News is also involved in all of the information that's going to be going out, so they will disseminate everything there. Again, this is a rapidly expanding incident, and we hope that the tribal membership understands that we are trying to be proactive here. We are putting plans in place. We also have some additional future plans that we also have set up here in the event of a confirmed case in a county that is adjacent to us, as well as plans in place of what do we do if we have a confirmed case here on the reservation. So with that, I guess, Vaughn, do you have anything additional?
So some people may wonder why we're taking these steps right now. And so I'll tell you a little bit about the coronavirus or COVID-19. It's considered a novel virus, which means it's new. What that practically means is that no one has any sort of immune system built up to this virus. Currently, there have been reported 127,863 cases worldwide. That's according to Johns Hopkins University. Of those cases, right now, 68,310 have recovered, which is about half of the population. Total deaths worldwide number 4,718. As far as the United States go, we've had 1,323 cases with 8 recoveries and 38 deaths. State of Wisconsin here, we've had 7 active cases, 1 of which has recovered. We currently haven't had any deaths. Part of the reason that we are taking these steps now is because the virus has what's considered an R0 rate, which means the number of people that are potentially infected from one case. They're looking at a rate of about 3.4 or 3.6 on record. It may be higher than this, as high as 6. So for every case or individual that gets sick, they spread it to that many more people. Just for a point of reference, the flu, which spreads very rapidly, is usually 1% or less per year. So this is much more infectious. Mortality rate with this is roughly 2.8 to 3.6%, depending on where you are in the world. Just to give you an idea of what that is compared to other viruses, the flu virus usually has a mortality rate of 0.1. So it's approximately 20 to 30 times more deadly than the flu. Just so people aren't panicking, usually the average age of someone who requires hospitalization is 60 years old, and the average fatality age is 80. This isn't to say that because someone's young and healthy, they can't get it, they do. And so precautions need to be taken for individuals to remain healthy or to minimize the length of symptoms.
We want to stress that some of the things to do as well is, hand washing. I know people have seen that out, so making sure that we wash our hands and use any type of sanitizer that we can. So with that, I guess there may be some questions out there in the public that may be asking some, so we could ask those from the live stream. Yeah, we're ready for those now if you want to do those. Are there questions?
There are questions, yeah.
Okay, we're gonna work through those.
Okay. The first question is, hello, why isn't the tribe sending medical professionals out to the elders and those people who can't get to the clinic?
So the clinic already does that, actually. That's what the job of the community health nurses are. So they are sending medical professionals. In the case of some individuals with symptoms, they ask that they call the clinic first. So medical professionals might have the opportunity to protect themselves with personal protective equipment. And so they are already.
Okay, the second question is, where is Incident Command located?
Incident Command is located here at the Menominee Tribal Offices.
Okay. Third question, how many trips does transportation make to these hotspot counties?
That we do not have an answer to that right now for transit.
Are family members able to pick up meals for our parents?
I believe that's going to be worked through with our aging department and at each meal site. I wouldn't think that would be a problem, but I can't answer that right now.
That is the only questions we have right now.
I want to thank everybody, and again, this is evolving, and we're doing what we can in order to keep our population safe. Thank you.
Thank you for your time and attention.